David Knight in studio, and we're going to switch back into some Ebola news before taking your calls at 1-800-259-9231. Earlier we had the clip from Anderson Cooper where he was talking to the partner of the Ebola victim there in Dallas. She basically said she got no advice whatsoever from the CDC on how to clean the apartment, that the Ebola-stained bed sheets and the towels that this victim had been using were still there in the apartment. Again, no proper advice on disposal. Now we have the hazmat teams being delayed because of a failure to obtain a permit. We've got Judge Clay Jenkins responding to this apartment, this potentially Ebola-infected apartment, who acknowledged, quote, some hygiene issues in the apartment. So that's how concerned he is. And David, as he said just in the break, the CDC seems to be the least concerned out of all these different authorities about this Ebola outbreak.
Absolutely, Paul. You've got these conflicts between different jurisdictions. One of the things that they're reporting in CNN is that we heard that there was a delay in the cleanup because a permit issue stopped it. Well, the issue is that the Texas Highway Association and Department of Transportation, others, do not allow these kinds of hazardous materials to just be transported on the highway. But of course, the CDC says that's not any problem. Just go ahead and do it. New York Times reports that part of this delay was that officials had found it very difficult to find a contractor who was willing to go to the apartment and clean it up, to remove the bedding and clothes, which they say was bagged in plastic. They found somebody. They're called the cleaning guys. And I don't know if
that fills me with confidence. Maybe it's the two guys who were hosing down the vomit off the pavement earlier.
Yeah, this is serious stuff. I mean, it is so incredibly stupid and incompetent that it is funny. It's kind of graveyard humor, isn't it? To see those guys out there, and the pictures that you see from the helicopter, they're out there, like you pointed out earlier, just in a T-shirt, hosing it down, and there's somebody walking by. I mean, that's actually spreading it around. That's not cleaning it up. No precautions no concern for the workers who are going in there and cleaning this up. No concern for the police officers. It was the guy who was president of the Dallas Police Officers Union who had the concern for his officers. There was still a cavalier attitude from the health department, from the CDC. They are the ones who don't really seem to get it. They don't really seem to care. If it is overkill, let's do that before we do have a lethal pandemic going out into the community. It seems like that would be exercising care over the top because they don't know how to contain this. Obviously, it's not contained in Africa. And there's a lot of questions that you raised yesterday. You pointed out people are raising as to how it's transmitted. We've had reports coming out of Canada where they believe that it is very easily transmitted by aerosols. And of course, that's not technically airborne, but essentially the same thing. I mean, it's they're arguing over semantics. So there needs to be more care because they haven't been able to confine this. They're doubling the number of cases that are reported at the CDC every couple of weeks still in Liberia. And they're projecting that it's going to be anywhere from 500,000 to 1.5 million people by January, just in those two countries that are hardest hit.
And here we have the tweet, again, which I showed earlier from Scott Gordon, NBC5 here on the document cam. 4 sheriff's deputies, health director, doctor went into Ebola victim's apartment without protection last night, Sheriff's Association says. And here you can see one of the images from right outside the apartment. You see 3 completely unprotected individuals being allowed into the apartment. Of course, we had the shock image shows unprotected workers cleaning up Ebola vomit in Dallas there on the document cam. This was shot by WFAA. And these guys were hired to hose down the pavement immediately outside the apartment where the Ebola victim was kept before he was taken to hospital.
Amazing.
Amazing. I mean, when I first saw this, I thought that's got to be some kind of hoax, some kind of unrelated picture. But we digged into it, and it's WFAA TV. It's confirmed.
It's amazing to see that. And then I was aghast at the time stamp on that. That was yesterday at about 1 o'clock in the afternoon. I mean, the press conference that was a couple of days after they had learned that this guy had Ebola, that occurred on Wednesday. And of course, at that time, we were told by government officials like Rick Perry and CDC officials that they were the most professional in the world. We had the best medical system. They were very well acquainted with how to contain this. They were doing everything that needed to be done. At that point, everybody was saying, but wait a minute, you sent the guy home with essentially an aspirin the first time he showed up at the hospital, even though it came out that he was from Liberia. They clearly weren't looking for that information. He mentioned it as he was being checked in. He said, I don't have a social security number because I'm not from America, I'm from Liberia. But it appears that the health care workers, not just the people who are checking him in and doing the processing of payment, looks like the healthcare workers were not screening for that. That's why that information wasn't passed along. But now it is far worse than that. If you stop and think about how long it has been, just today they're getting there to clean the apartment. They just cleaned the sidewalk yesterday. You had the ambulance worker who said that they didn't notify the fire department for days after everything happened. They took 48 hours to quarantine the ambulance. When you look at how much stuff was done, it wasn't just sending the guy home to percolate for a couple of more days before he got much worse and brought to the hospital again. I mean, we're seeing an avalanche of information about how they've dropped the ball here over the last 3 or 4 days.
And here's the article that David just mentioned there. Dallas paramedic slams health officials, was not informed of Ebola diagnosis, drove contaminated ambulance for 2 days. He says the reports of officials tracking those potentially contaminated are, quote, bull crap. Those are his words, and this is the quote. 3 days after the fact, I had to demand exposure testing, and they are reporting following up with all the people in the ambulance, question mark. Bull crap. They haven't even followed up with the 10 firefighters that were on duty Sunday. So, David, I mean...
This guy is outraged, and he ought to be outraged. He's been exposed to a disease that kills 70% of the people in a horrific way. His family has been exposed now indirectly because there's also a possibility that it could travel to them. This is something people need to get angry about. They need to demand that these people are going to do something. We've seen them just pull back and allow undocumented Democrats to come in over the borders, not do anything about any of this, pretend that they've got the borders sealed, pretend that they've got everything under control with the CDC. They clearly are just trying to preserve their careers. These are people who, like Obama, have never, ever done anything in their life other than run for political office or get a political position. And so these people at the top are trying to assuage everybody's concerns about this while they do absolutely nothing. It's the people who are not even involved with the CDC that are doing things. People need to be aware of what the dangers are for themselves individually. Your government, as usual, is not going to be there to protect you. You need to take your own precautions. But now, before it affects somebody in your family, now is a time for people to get angry and to contact these people and demand that they do something. They're asleep at the wheel.
I mean, how long before we start to call for the head of the CDC to be fired over this? I mean, heads need to roll, surely.
That would be the very least. And of course, there was the article from on Infowars.com earlier today about how Obama, back in 2010, quietly rolled back precautions that would be in place for just this type of thing. At the time, they were worried about bird flu. And of course, we had 21 million people killed die in 1918, far more than died in World War I because of flu. And that was transmitted because of people returning home from areas where there was a war. And so it's that kind of travel. Today, we have a very dynamic world where people are traveling across the globe in very short periods of time. I mean, back in 1918, if you had an Ebola situation like this, many people on board a ship would have already been showing symptoms before they got to the United States, probably. But today, they can do it in just a few hours. And so that's something that is of great concern. So they had regulations in place that would have required the airlines to keep additional records so that they could go back and do contact tracing in case something showed up. That was pushed back by the airline industries. The American Civil Liberties Union was concerned that there were going to be records kept of people. That was before we learned about Ed Snowden. That was before we learned that they're keeping records on everything. Of course, the only thing that they really are not going to stop keeping records on is anything related to political power. They want to know everything about who is a threat to them politically, but they don't want to know anything about something that would protect the American people.
And going back to the airliners, obviously the CDC has come out repeatedly, said they're not going to call to block any airlines. As far as I understand it, David, the direct flights from West Africa, do they go into Washington Dulles?
Well, it's not clear. I mean, there's a lot of different airlines that will go. Usually there are intermediate stops. Usually there's at least 2 to 3 stops when you're looking at traveling from Liberia to Dallas, for example. If you're going to an East Coast city, you might get there in just one hop. I don't know that there's any direct flights going from East Coast cities to Western Africa. I'm not sure. But the issue is that the airlines know when you get on a plane, they know what your itinerary is there. But there's other methods that they could do. If they were to keep track of people's, if they were just to hold the records of people that had traveled on planes, then if something were to happen like this, they could backtrack it and look at contact information, which would be something that would actually benefit the people who had been on the plane. It would be something that, in retrospect, would be helpful to them. As you mentioned, when you traveled and there was a concern about flu, they came onto the plane where you were a passenger. Where was that? China or mainland China? Yeah. They came onto the plane in hazmat suits and checked people for temperature and that sort of thing. So there's certain things that they could do. Nothing is 100% certain, but there's things that they could do to minimize the risk. And that's the point. You're never going to have anything that you do that's going to be 100% effective, but you can do your best to try to minimize the risk. They're not even concerned about that.
Breaking news as well out of Politico. Bobby Jindal, Louisiana governor, banned travel from Ebola nations. He's calling on the Obama administration to impose a travel ban on flights coming to the US from countries with Ebola outbreaks. So prominent individuals now starting to call for that. We'll cover Hong Kong, the internet, more news coming up. Obviously, we're going to dip back into Ebola. Your calls as well coming up at 800-259-9231. This is the Alex Jones Show live, Infowars.com. Your calls straight ahead. Keep it locked in. It's the Friday edition of the Alex Jones Show with me, your host, Paul Joseph Watson, joined by David Knight in studio. We're just going to dip back into the latest Ebola news. David, we had this revocation of this 2010 CDC measure, which kind of would have protected to some extent America against potential Ebola victims coming in from outside the country. Tell us about that.
Yeah, this is the original article back in 2010 from USA Today. It says Obama administration scraps quarantine regulations, and they start out by saying that the Obama administration quietly scrapped plans to enact sweeping new federal quarantine regulations. These were regulations that they'd proposed back in 2005. It would have given the federal government additional powers to detain sick airline passengers, and it would have required that airlines report passengers that are sick to the CDC and require that they collect and maintain contact information for flyers if they later need it to be traced. Now, this was removed under the pretense that, well, we don't want to violate anybody's privacy. Look, they're looking at everybody's records when you buy your plane tickets. They're completely investigating your background. They're keeping that information. And of course, we subsequently learned after 2010, we had been telling people this for quite some time, but now there's no question about it, that our government is spying on every detail of our life. This isn't a privacy issue. This is something that could actually help people who were flying on the plane with someone who is sick. But of course, that was scrapped 4 years ago. And now we see that that's exactly the type of thing that needs to be done. But of course, the federal officials are not interested in that. Rather, they're taking a very cavalier attitude about that. There's some breaking news about what's going on in the schools there in Dallas. I saw this one. This is an article, I think it's up on Drudge from the Telegraph in the UK. And they were talking about missteps that had happened over just the last few days already with this Ebola patient in Dallas. And one of the things that they said was that 5 children who went to 4 local schools in the area that had direct contact with him were only pulled out of school on Wednesday, on the 30th. Now, he went back in anywhere from 2 to 3 days before that. They knew that he had Ebola. And this is about the time that they're doing the press conference, talking about how professional everything has been. Yet for 2 days, they allow these kids to continue to go to school there in Dallas. And they point out that one of the schools is only a few hundred yards from the apartment where he lived. And they were just out there blowing, just cleaning yesterday the sidewalk there where he had been sick and throwing up and just, spraying that around with a pressure washer. I mean, it's just amazing to see what they are doing and what they're not doing.
And as David mentioned, this is a tweet from WFAA, and that was, again, the same news organization that provided us with a picture of the pressure washer cleaners hosing down the Ebola sick, wearing no protective gear whatsoever. A tweet out of reporter Sebastian Robertson, breaking Dallas company to install 5 remote temperature monitors to 5 schools with potential Ebola exposure. So, David, we know that this Ebola victim had contact with numerous children. There was concern about that several days ago. What does it tell us now that these 5 schools are installing remote temperature monitors in the Dallas area.
Well, it's been a day late and a dollar short from the very beginning, hasn't it? I mean, they're not getting up to speed nearly quickly enough. They're not being precautious enough. They're coming into this with an attitude that everything is under control. We're professionals. We know everything. They're trying to protect their jobs. These bureaucrats need to understand that if this pandemic gets out of hand, they're going to die along with the rest of us. They're not going to have their pass into the underground bunker with Obama. I think Chris Matthews kind of realized that the other day when he said, wait a minute, Obama promised this wasn't going to happen. And that was just a couple of weeks ago when he was at the CDC. It's a very unusual step for a president to go to the CDC in the first place. But, you know, this is the sort of thing that they need to take precautions on. They were talking about what happened in the kind of an hour-by-hour breakdown of what had happened. This is a Washington Post story where they interviewed one of the people that's in his family, and she was talking about how she's actually the daughter of the person that he was living with, and she said that she went down to Walmart, bought him a blanket, brought it back, and she said she knew because her family and friends are from Liberia. She knew how it started, that it starts with, and this is very important, listen to this, it starts with muscle pain and red eyes as well as fever. So when she saw all three of these things present, she pretty much knew that he had Ebola. And she was the one who contacted the ambulance. Again, he didn't want to go because they had just sent him away essentially with some antibiotics. In other words, take a couple aspirins and, you know, call us in the morning, that type of thing. But she was the one who contacted the crews, and her children were some of the children that came in direct contact with him.
We're going to cover this and more after the break. We're going to dip into some geopolitical news as well as the UN's latest attempt to control the internet. Going to go to your calls, 1-800-259-9231. I'm Paul Joseph Watson. David Knight also in studio. This is the Alex Jones Show live, Infowars.com. Stay tuned.
My friends, Alex Jones here to tell you about some of the most important information concerning you and your family's health. Radiation levels have more than doubled in the last 60 years in the Northern Hemisphere from all of the nuclear testing and radiological accidents. Radioactive contamination is now in most of the food supply. There's only two ways to avoid this. Move south of the equator or properly protect your thyroid with nascent iodine. Looking to protect my family, I've done deep research. Nascent iodine is the purest, cleanest, absolute best form of iodine to protect yourself and your family. It's made right here in the USA, completely non-GMO. I searched out the best quality and now have developed a double-strength form of nascent iodine, exclusively available at InfoWarsLife.com. Nascent iodine is on record as one of the only safe ways to detox from fluoride poisoning. Survival Shield Nascent Iodine. Secure your super high-quality nascent iodine today at InfoWarsLife.com. That's InfoWarsLife.com.
We're back on the Alex Jones Show live. David Knight in studio. I'm your host, Paul Joseph Watson. Alex will be back on Sunday. We've got breaking news up on Infowars.com. Report Liberians flood airport attempting to flee Ebola-struck country. This is an article by Kit Daniels. Liberians are apparently flooding Roberts International Airport in Harbel, Liberia, in an attempt to flee the Ebola-struck country, raising fears that more people infected with Ebola will fly into America. Elsewhere in this article, they talk about the visas being processed for Nigerians also going through the roof, skyrocketing. So it appears that this trend of Ebola tourism, which we talked about earlier, could indeed be coming to the fore. And, you know, if these Africans realize that they can get treatment in America, whereas in comparison in places like Liberia, people are literally dying on the streets. They're stumbling to get into hospitals, which are completely overwhelmed. Then it is an incentive to try and get to America to get proper medical treatment. Of course, earlier we covered the story out of Breitbart where the co-worker of the Ebola victim said that he admitted he had basically flew to America as part of a desperate attempt to survive. There you see the headline. So this individual went to America by the looks of it deliberately, according to his comments, to get treatment as David Knight, an Ebola tourist.
You know, Paul, the part of what the media is selling in terms of telling people that we have some cure here called ZMapp, that's part of the fallacy that's going to be driving this. if by some chance he recovers, that's going to add even more impetus to it. And it was just yesterday that we had that doctor put on a full biohazard suit and go through the airports with written on it, the CDC is lying. And one of the things he said is, as this builds in these countries, there's going to be a lot of pressure for those people to leave those countries en masse and to go somewhere else where they believe that they will get better quality care. They're projecting, again, 500,000 to 1.5 million people, the CDC is projecting, in Liberia and Sierra Leone by January will have Ebola. That's about 5 to 15% of the population in those two countries. Once it gets to that point, they're already to the point where the government has essentially broken down in most areas there, and at least in Liberia. So these people are desperate to get out of there. They're being granted visas with no conditions. We can't have any quarantine conditions put on there. They're just allowing these people to come. This is political correctness to the most absurd extreme. When we see the director of the CDC saying that the right of return is more important than preventing the disease from spreading, I mean, what in the world is he talking about with this new right, this right of return? Since when has the American government ever been concerned about our rights when we're traveling? I mean, whether you're traveling by plane or by car or even crossing a border, they've maintained for the longest period of time that you essentially have no rights, that they're going to do anything that they wish to you. And yet we've got something called a right of return that trumps everything. What is this guy talking about? You have any idea? I don't have any idea what he's talking about.
It just doesn't seem credible, does it, that the feds are suddenly really careful and caring about our rights in the face of this potential Ebola outbreak. Whether they're trying to dampen down the hysteria by not blocking the flights remains to be seen, but their very incompetence and inaction has only created more hysteria. We're going to go to some of your calls now on the subject of Ebola. Mike in Maryland, you're on the air. Go ahead, Mike.
Hey, thanks for taking my call. And I tell you, that Syrian lady, she's one courageous person here. I wanted to bring, it's an honor to talk on your show, by the way. I want to bring something to your attention. This is from the Frederick News Post, dated October 1st. Frederick, you know, is the home of Fort Detrick, Maryland. Might remind the listeners here. The title of the article from the local paper is Federal Decision to Bring Ebola Patient to Airport. And the article goes on to say that the decision to fly an American physician into Frederick out of the heart of the Ebola outbreak was made with little input from local officials. The State Department decided Sunday to fly the physician from Sierra Leone versus the guy from Dallas that came from Liberia. So he's from Sierra Leone to Frederick Municipal Airport. The doctor's identity is not known, but the person was exposed to the Ebola virus while volunteering for an aid organization. The National Institutes of Health has not yet confirmed or denied if the physician has contracted the deadly disease, according to the Centers for Disease Control and Prevention. The virus has taken more than 3,000 lives in West Africa. The city has been working on a memorandum of understanding with NIH and Fort Detrick regarding procedures when the city airport is used to transport patients. Frederick Mayor Mandy McClement said, I can go on if you like. If you, I don't know.
No, we've got the article up. I've got it up. Local officials had 1 day notice before doctor exposed to Ebola flown to Frederick. So again, David, you know,
it's interesting that they'd fly him into that location where Fort Detrick is, because that's where they work on bioweapons. And there's been a lot of talk about the involvement of the U.S. military. Of course, the U.S. military is deeply involved with this ZMapp vaccine, which apparently doesn't look to be necessarily effective. It was given along with blood transfusions, and it's not clear that the two people who recovered from the blood transfusion, or did they recover from the ZMapp vaccine? They were given both of those things on the same day. And so it's not clear. In both of those cases, both the ZMapp vaccine comes with antibodies. In other words, it's not giving you a version of the virus that your body then reacts to and creates antibodies. No, they're injecting you with what they call plantibodies, because these are genetically modified organisms, antibodies that supposedly of Ebola that were grown in plants. But when he got the blood transfusion of an Ebola survivor, he was also getting antibodies from that guy's blood. So in both cases, he was getting antibodies. There were subsequently other people that were given ZMapp who then died. So it's not clear that that is a cure. But just talking about all this fear mongering that's going on, that everybody's saying there's fear mongering, there's panic about this. Look at the fear mongering that goes on just a couple of weeks ago about global warming. People were marching by the thousands in streets of various countries and protesting, saying something needs to be done about global warming. Look, nobody has died from global warming. It's not something that can even be measured, according to most scientists. It looks like that's a trend that they're now saying it's a pause in global warming. Well, it didn't happen. They measured an increase in CO2, but their models that predicted a subsequent increase with temperature, that hasn't happened either. And yet we have a real hockey stick here. You know, Al Gore is pushing the hockey stick that Michael Mann created, saying this is the end of the world. We do have a hockey stick going on with this pandemic in these countries, and people don't understand what to be afraid about and what not to be afraid about. They don't understand how to assess the risks, and that's what's really concerning me, is trying to get this information out, what people need to be concerned about, what the real threats are here.
Sanger in Texas, you're on the air. Go ahead.
Hi, gentlemen. Thank you for having me. Just touching on the subject of Ebola and what Alex has been talking about lately about internet censorship. Right now on Instagram, if you try and type in natural feed, it's called Garcinia cola. If you try and type it in on Instagram, they won't allow you to actually post it. And certain friends of mine have actually had themselves logged out of their account and their password changed, and it happened to me as well. And so I just wanted to inform you and the listeners as well that there is censorship right now of our internet, and there is something that can stop the spread of Ebola that they're not letting us be aware of.
So you're saying that Instagram is censoring images related to Ebola or information?
Yes, if you try and post a comment, and I just tried to tag Barack Obama's official Instagram on it and send it to him, and Instagram will have a notification that comes up and it says that it goes against their policy and for the protection of users, and if you have a problem, you can either try and contact them or just dismiss it.
Okay, that's interesting.
Do you think they ever censored a picture of a lonely polar bear sitting on an iceberg? Do you think they ever censored that?
I would think that that would be okay.
Yeah.
In the past decade, we have witnessed unparalleled scientific discoveries in the area of health. But no one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. DNA Force is one of the most expensive formulas to produce. Some of the ingredients in DNA Force are $12,000 a kilogram. We are using the coveted, patented, only American source of PQQ, CoQ10, and more. You want the best that's out there at the lowest price anywhere? Well, we're bringing you a total win-win. The ultimate value, cutting-edge, trailblazing game changer that also supports the InfoWar. We have produced a limited run of DNA Force, and it will take up to 12 weeks to produce more once we sell out. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA Force from InfoWars Life.